The number of people accused of crimes in Texas unable to stand trial as they wait in jail for mental health treatment at a state hospital has hit a new record. Our investigators have shared their stories with you, including how some people die while they wait, and the state is not tracking those deaths. Late last year, the state committee charged with oversight of the wait list said it would look at collecting and analyzing some crucial data on individuals waiting to hopefully help drive down those numbers. Last week, the committee met for the first time since our latest investigation with some bad news and some good news. The committee has a new leader who tells us he's seen our report and recognizes more work needs to be done. The new chairman is a longtime former sheriff out of Limestone County and the former president of the Sheriff's Association of Texas, so he's well versed in what goes on inside county jails. Right now, this is the record-setting reality. We told you in the fall when the number of people waiting in jail for a state hospital bed hit an all-time high, more than 1,800. Well, it kept going up, hitting a new high this month at more than 2,100. That state committee has put a lot of the blame on the COVID-19 pandemic, and a staffing shortage at those hospitals we've now learned forced many beds for potential patients offline. Last week, the state announced hiring bonuses up to $5,000 for certain positions at state hospitals across Texas, hoping to attract more workers. But the committee chair acknowledges that could take time, and the need right now might warrant emergency action.
The National Guard obviously might be one of the issues that we would put on the table for consideration. I just think the problem is so huge that it's going to take everybody that's going to have to come together on our team to work together to come up with a viable solution.
When it comes to the data the committee has not been tracking on people waiting in jail, we saw some improvement at Wednesday's meeting. Race and ethnicity were added to the dashboard, though we believe the numbers are likely incorrect because, as you may remember, we discovered the places the committee's getting the data, courts and county jails, are not always collecting it accurately. But this is at least some progress, giving us a surface level look at the race and ethnicity of the people on the maximum security wait list, for instance. By these numbers, black people are waiting longer on average in jail for mental health treatment, 526 days, followed by the Hispanic or Latino population at 464 days, then those listed as white at 415 days. Knowing that makeup can help the committee understand where to better target solutions. But despite saying they would look closer this month at indigency and homelessness, two major factors experts tell us contribute to the wait list, the committee has yet to take up that data discussion. And we also saw no movement toward tracking the number of people dying while they wait. The chair tells us that could take lawmaker action in next year's legislative session.
As far as the tracking the data, and again, it's more paperwork for the local sheriff to have to fill out to respond to a state agency's request. It could come down as a legislative issue. It could come down as a legislative mandate.
You'll recall we discovered at least a dozen deaths in Texas' most populated counties since 2015, but those numbers are likely greater the more counties you add to the total. We will continue to track this committee and its progress in bringing down the still climbing wait list numbers. You can catch up on our team's reporting, including new interactive data features. It's all linked to this story in the Texas Politics section of our website.
Not because of y'all, because y'all failed the system.
A mother lost her son in a crash with the car that she says should never have been on the street. A new update to our investigation into risky rides, sporting paper tags, putting your life in danger on the road.